Just a couple of general features about the heart. The heart is approximately the size of an individual's fist and weighs about 250 to 300 grams. If you talk of surface anatomy, it basically lies retrosternum, that means just behind the sternum, and anterior to the vertebral column. On either sides are the lungs, and the heart sits on the diaphragm. So the inferior portion of the heart is basically sitting onto the diaphragm. Now, marking the borders of the heart, if we take a look at the surface anatomy, imagining this to be the sternum and the ribs that pass out on each side, if we mark if we mark the third intercostal cartilage and the fifth intercostal cartilage on the right side and join these two lines, this forms the right border of the heart. Taking the second intercostal cartilage on the left and the fifth intercostal space in the mid-clavicular line and join these 2 points, we can mark the left border of the heart. This becomes the superior border and this becomes the inferior border. So the inferior border of the heart basically extends from the fifth intercostal cartilage to the fifth intercostal space, all on the left side but in the mid-clavicular line. And we said that the inferior border sits on the diaphragm. Now this heart is enclosed in a rough and tough bag-like structure which is known as the pericardium. This pericardium has 2 layers. The first one is the thick fibrous layer, whose function is basically going to be protection of the heart, and the second one is a serous layer. When we say serous, we mean that there's going to be some fluid which is present. Now, where exactly is that going to be present? So the serous layer in turn also has 2 flaps. One is the visceral flap and one is the parietal flap. The parietal is going to be the outermost part, the visceral is going to be the inner part. And between these 2 layers, we have the pericardial fluid. Pericardial fluid helps to avoid any kind of friction when the heart is contracting and relaxing. So between the bag and the heart, if the fluid would not be present, then there would be a certain amount of friction. To avoid that friction, we have pericardial fluid. Now this visceral pericardium is very closely attached to the heart, and which is why it has the other name epicardium. Epi means the most outer layer. The most outer layer of the heart is the epicardium, which is basically the visceral pericardium. Underneath the epicardium, we have the myocardium, myo referring to muscle. So the bulk muscle of the heart is formed by the myocardium. And underneath the myocardium, we have the endocardium. Endo means inside. So endocardium basically is a lining of endothelial cells which are lining the inside, the innermost line of the heart. So we have endo, outside endo we have the myocardium, outside that we have the epicardium, which is basically the visceral pericardium. Outside of that we have the fluid, and then we have the fibrous pericardium. So now when we are just talking about the general anatomy of the heart, we know that the heart is made up of 4 chambers. We have 2 smaller upper chambers and we have 2 larger lower chambers. So we have 2 right-sided chambers and we have 2 left-sided chambers. The upper chamber are known as the atria, which are the smaller chambers, and the larger chambers are known as ventricles. Now, how are they divided? Within the atria, there is a septum, which is going to be known as the intraatrial septum, and between the ventricles is going to be a thicker septum, which is known as the interventricular septum, and this helps to divide the chambers on the right and the left side. But between these we have valves. On the right side we have the tricuspid valve, tri meaning 3, cuspid, 3 cusps which make up the valve. On the right side we have the mitral valve, mi meaning 2, so 2 cusps of the heart. And these two valves make sure that blood does not flow from the ventricles into the atria. It maintains a unidirectional flow. So what do the valves do? They maintain a unidirectional flow. Now from these two ventricles arise the two great vessels. From the right side comes out the pulmonary artery, name suggesting pulmo means lungs, so they are going to be carrying blood to the lungs. And from the left side we have the great aorta, which is going to be carrying blood to the rest of the system. Now in the next section we'll talk about mechanical blood flow, where we'll be discussing the 3 circulations, which is the systemic, pulmonary and the coronary circulation. This ends our discussion on the anatomy of the cardiovascular system.